Welcome to the Grow and Go podcast, where we are discussing feeding in the under fives in the early education setting. Your hosts today are myself, Helen, Claire and Stella, and we're all accredited practicing dietitians with a special interest in children's nutrition. This podcast is being recorded on the lands of the Yagara and Turrbal peoples, and we pay our respects to their elders past and present.
Today we'll be talking about the role of education and health professionals in the nutritional care of children under 5, including understanding what different health professionals do and where families might be able to access them. So, Helen, would you mind giving us a bit of an overview about what the roles of educators are regarding nutrition and the feeding of children in their care?
The scope of practice for Australian early childhood education and care staff regarding nutrition and feeding is actually quite large, and it's based on national regulations and standards, and these provide guidelines for early childhood education and care services in Australia. According to some of these documents, staff have the following responsibilities, right from supporting breastfeeding mums by providing comfortable and private space for breastfeeding or expressing milk, having a ability to safely store and handle breast milk, and respecting the mum's wishes and needs with regard to feeding. As the child gets a little bit older, providing nutritious and adequate food and drinks according to their dietary requirements, preferences, and importantly, cultural backgrounds. This includes planning and preparing menus that meet Australian dietary guidelines, offering a variety of foods from different food groups, plus ensuring food safety and hygiene practices. Really important in the food space is enabling children to enjoy their meals and snacks, creating positive and supporting environments for children to enjoy food, role modelling healthy eating behaviours, and encouraging children to try new foods without pressure or coercion. We know that first few years of life is really important in encouraging children to have a wide variety of foods, and early childcare and education is an important venue and space for kids to be able to experience those new foods. So you are promoting learning and development through food and nutrition activities, and this might include involving children in preparing or choosing foods, teaching them about healthy eating and physical activity, as well as providing opportunity for them to taste different foods with different textures, food shapes and different colours. Always remembering, though, that staff need to respect families' rights to make informed decisions about their children's nutrition and feeding, and providing them with relevant information, communicating and collaborating with families and health professionals about children's nutrition and feeding needs is also critical. This might include sharing information about food and drinks, displaying weekly menus, seeking feedback from families, and respecting their choices and values, as well as seeking advice from health professionals when needed. One easy way to help families find quality information is to share the Grow and Go toolbox with them. In particular, when they're looking for a health professional, the Find a Health Professional tool has been specifically designed to help families find the right health professional at the right time in the area in which they live.
Okay, so Claire, would you be able to take us through what are some things to look out for relating to nutrition and feeding that might give us an indication that we need a little bit more professional support?
Yeah, of course. And I think the first thing to mention here is that it's really important that educators spend some time discussing any concerns they have with the child's families and carers, just to see whether this is a one-off incident or whether it's something that is happening at home as well as in care. And this also gives you the opportunity to discuss whether you think this needs to go to a health professional for some extra input. So things for you to consider. So first of all, I'll mention things that might be to do with allergies or intolerances in an infant. So if you've got a bub that you're caring for who seems to have chronic reflux that doesn't seem to be responsive to other reflux management strategies, I imagine if you have an infant who has this condition and is already having some sort of intervention for reflux management, it's possible a health professional's already been involved at least at some point in that process. But if it feels like it's an ongoing issue that's not getting any better, this could be a possible sign of allergy or intolerance. Other things to look out for are things like explosive smelly stools, or the other end of the spectrum, chronic constipation. Any kind of reaction immediately after feeding in terms of things like rashes or hives and things on the skin, and inconsolable crying for extended periods of time, again, often linked to those feeding episodes. In terms of identifying if an infant might have reflux initially, if you're seeing a baby that you're caring for who arches their back after most meals, or an infant who cries and wriggles during most meals, or an infant that then vomits after most meals. So if that sort of behaviour is happening on a consistent basis, this could possibly indicate reflux in that child. Other things to look out for that might need a little bit of health professional input could be things like gagging on milk or gagging or choking on solids consistently, depending obviously on the age of the child. A dependence of certain textures of food, so wanting to go for those purees and not wanting to have lumpy foods or anything like that. That can be, when you're talking about a bub of sort of 8 months or more, we're talking about that not being appropriate for that age. Or if they've completely missed a feeding milestone, so they're not interested in solids by 8 months, they're not on family foods by 12 months, those sort of key ones. Now, in a slightly older child, we're thinking sort of the toddler age group here. Some possible signs of food allergy, again, can be those skin reactions, so hives or rashes immediately after eating a particular food. If they complain of tummy aches after eating a food, obviously things like vomiting could be a sign of this as well, usually within the 2-hour period of a meal, when of course there's no other clear cause. So for example, you know that none of the other children have had gastro recently, there's no chance of it being an illness like that. And constipation is another one that often is missed when it comes to potential food allergies. If the child is having issues with constipation and this isn't responsive to dietary changes, again, might have already had some health professional input or GP or nurse input here. But if that is not getting any better, it could possibly be due to an underlying food allergy. And again, that chronic reflux, like we mentioned in the infants, could be to do with allergy as well. Some other things that are important to look out for in that toddler age group that could indicate the need for some health professional input: frequent choking, gagging or coughing during meals, refusal to take on meals with a different flavour or presentation, being quite restrictive in what they eat, avoiding foods of certain colours or food groups, avoiding certain textures, having issues getting them to move through to more complicated textures, again missing those feeding milestones as well. So if we're talking about a child over 12 months here who doesn't have the ability to eat family foods, then that's a bit of a concern. Reports of any feeding difficulties in different environments. So if there's variation between what's happening at home versus care versus when they're, with grandparents, etc. A kiddie who's getting physically distressed, so crying potentially at meal times or is very disruptive at meal times, probably needs some consideration. And if you're worried about a child who looks like there may be some potential issues with ongoing poor weight gain, or if a kiddie is significantly smaller than their peers that you feel that is unusual, or if you're talking about a child who maybe is unable to keep up with or can play with their peers in the same way, maybe they're fatigued, for example.
Thanks so much for giving such a thorough list of things to look out for. And obviously these are just things that you might notice and you might want to, discuss with the family. However, it's not your responsibility as an educator to diagnose or figure out exactly what's going on. It's just your responsibility to say, hey, I've noticed these things, and then perhaps give a little bit of guidance on where to go next. So on that, where should we be, supporting parents to go to if they do suspect that there might be something going on with their child's feeding?
Well, there are a couple of places where you can make a first start. The first being your maternal child and family health nurse. So this person is probably your mum's best friend in the first 5 years of life and the first point of contact for all health-related issues for children under 5. These nurses offer valuable insights and practical tips to help parents navigate the intricacies of parenting, and even better, their services are free for all Australian babies and children from 0 to 5. The maternal, child and family health nurses are all trained to help across many topics, from breastfeeding to formula feeding to addressing concerns like burping, baby vomiting, introducing solids, fussy eating, as well as important roles in things like checking child's growth, development and learning. They can also help with things like sleep if your baby isn't sleeping that well, which again impacts on food and nutrition down the track. The other health professional who is really useful in that first 5 years of life is your general practitioner. General practitioners or GPs are doctors who specialise in a broad range of general medical issues across all ages. They're a really good person to talk to about any concerns that a family might have with their child, including growth and development or indeed food and nutrition. The GP is able to provide referrals to specialists such as paediatricians, or indeed can refer families to an allied health professional to meet a specific need.
And what are some of the allied health professionals that the doctor might suggest the client goes to?
That's a great question. So there's probably 3 main allied health professionals that you'd be referred to for a feeding-related concern. So first of all, dietitians. They are specialists in feeding and eating for healthy growth and development, and they can also manage special diets for children with more complex health needs. So they can help with things from figuring out how much breast milk or formula a baby needs, checking baby's growth, what to do in terms of feeding if a child is having issues with their growth, what to feed baby if they have a specific health condition, so maybe an allergy, for example. They can give advice to mums about what they should be eating during pregnancy and breastfeeding. They can also support families when babies are being introduced their first solids and help manage any nutrient deficiencies like low iron. The other one to consider is a speech pathologist. So these guys are specialists in communication, swallow and eating skills, so things like the chewing process. And they can help with all sorts of things from coordinating sucking, swallowing and breathing whilst breastfeeding, appropriate latch and positioning for baby when breastfeeding, and they would often work with a lactation consultant in that space. They're also specialised to interpret babies' behaviours during feeding and setting up a really positive feeding environment, and also assessing things about how baby's mouth, tongue and lips are working and helping you make the most out of that situation. The last health professional that you might be referred to around feeding is an occupational therapist. So these guys are really specialists in helping people be independent in their daily activities. So they're educated to help families with things like setting up a positive feeding environment, finding the right kind of furniture, utensils and equipment for meal times. And this could also be for children with special needs and disabilities as well. They can give suggestions and support around helping kiddies who are having trouble with sitting and holding their head upright to be able to feed. They can help with any issues to do with toileting, and they can also be involved in supporting families where a child has sort of picky or sensory-based eating preferences, where they maybe only want to consume certain textures, smells, colours and tastes of food.
Okay, and so once a child does start seeing one of these professionals, how can educators best work alongside those health professionals?
It's actually really important that the education and the health professionals are working together to ensure consistent and coordinated care for the child. Of course, this can only be done if the parent has provided consent for you to discuss their child's health with a particular clinician. So you might be linked in with someone to talk about behaviours that are happening in the centre. You might receive information from a health professional on how to apply certain interventions to help support the child. Some centres may even have visiting OTs, physios or speech pathologists who come on site to work with the children while they're in your care. And these providers can also answer your questions in relation to that child's care, just to make sure there's consistency across the board. Additionally, asking parents if they would like the centre staff to be involved in the child's stakeholder meetings or case discussions can also be a really valuable way of providing information across the team and communicating broadly.
That's really great to know. And is there any easy way for families to find the right health provider?
One of the things that we found when we were setting up the Grow and Go toolbox was the need for families to actually have some information about what different health professionals did and potentially where they could find them. The Find a Health Professional tool tries to sort out this issue and aims to help families find which health professional they need to speak to and where they may be able to access them locally. You can either point families towards the tool or help navigate it to find a suitable health professional to support them. We know sometimes these conversations can be difficult, so sometimes using your centre's socials to help families locate a health professional, perhaps providing a short bio or introduction to your local pharmacist, your local maternal, family or child health nurse, or supply the link to find a health professional tool from the toolbox. We hope all these things will be helpful to you to help support your families to be able to find the health professional that they need when they need it.
And that brings us to the end of this episode. We hope you found this a useful introduction to some of the resources that are now available. For more episodes alongside many free resources to support your centre and families, visit the Grow and Go Toolbox at growandgotoolbox.com and check us out on social media on Instagram and Facebook for regular tips on feeding the under fives. We would like to acknowledge the Commonwealth Department of Health and Aged Care for the funding for the Toolbox and the University of Queensland for supporting this project.